check Mrs. Smith's chart, look for a diagnosis, order for indwelling catheter. We've checked for any allergies that would prohibit us from proceeding with the procedure, and any allergies, like I said, identifiers and any issues that would stop us. Of course, I have to wash my hands, knock on the door, introduce myself. Hi, I'm Robert, your student practical nurse today. We're going to insert an indwelling catheter in you. This is to help you with your urinary retention. The procedure should take about 10 minutes, 10 to 15 minutes. It's not pleasant, but we'll try to do it as best we can, quickly as we can, and improve things, help improve things when it gets done. If you don't have any questions, if you're okay, we'll go ahead and start the procedure. I'm going to wash my hands. I've assembled my equipment. I am going to palpate I'm going to wash my hands, put my gloves on. I'm going to go ahead and palpate your bladder, make sure there's no distensions. So we'll start the procedure. That feels good, no distensions there. Go ahead and put you in a dorsal recumbent position. I'm going to perform pericare on you before we start the procedure, which we would do it as we would normally in the other procedure. We would wash the two outer sides and then the inner side for the normal pericare. I'll just take off my gloves, re-wash my hands, then we'll start the procedure. And we have our dorsal recumbent position. I'm going to make a sterile field with her legs. I do need to identify you. Can you give me your name and date of birth? Okay, that checks out with my records. I'm going to first, after I put that, I'm going to put my sterile gloves on. I wouldn't be touching anything, obviously. I don't have these on. I've already re-washed my hands before I put the sterile gloves on. Gloves are on. Already washed them obviously before we put them on. First thing we're going to do is take cover and we're going to cuff the ends with the shiny side down. Ms. Smith, if you can raise up your hips a little bit for me, I'll place this right there. Fantastic. We're also going to put on drape right there. Our kit, we're going to take the iodine and put that over the cotton ball swabs. If we do that, we'll put those in the trash. Also, we're going to put the lubricant in our tray. Making sure we don't touch anything that's non-sterile. Recap that. We're going to, at this point, with my non-dominant hand, is spread the labia, and we're going to wash or perform pericare. cotton balls from front to backwards. One side, discard that. Do the other side. Down, straight down the middle. Do that another time. Using up all the cotton balls. Discard that. We would not release that. We'll go ahead and take the catheter, lube it up approximately up to 3 inches when it's well lubed. We'll go ahead and insert that. This is Smith. If you'll bear down for a little bit for me, let's make it a little easier for us to insert. We'll insert this again to about 3 inches. And once that's in place, you see maybe a little urine coming out. We can release at that point and insert 10 milliliters. It's going on just fine. You can disconnect that when that's done. Discard that. And we would go ahead and tape this to the thigh, the tube to the thigh. The bag, again, we'd make sure that it's closed, in a closed position. We would attach this to the bed frame of the bed with making sure it doesn't drag the lamp around. Make sure it's closed. And there isn't any kinks or anything that would disturb the flow. And we've done that. So at this point, we would go ahead and remove. Let's say we're discontinuing it. We would reverse the process by putting that would still be on the side of the bed. Put the syringe back on, which it will deflate itself. Back to the 10 milliliters. That's just about done. Remove the catheter. Remove the items, throw all these away, and that would be it. We'd go ahead and record our findings, the urine type, the consistency of the patient, tolerated procedure, note any that we used a 14-inch French size catheter, any consistency of the urine, any problems if the patient tolerated it well. And we'd again at the end discard equipment, wash your hands, do a pericare, cover the patient back up, put the position the patient back in their position with their head up. We'd wash our hands in between after we did the pericare, cover the patient back up, lower the bed. And make sure that the patient has any issues, any questions, give them their call light, and then we would go over, like I said, record our findings that I spoke with earlier. That's it.